Hello, in this video we will discuss about the Turner syndrome. So what is the Turner syndrome? Basically it is genetic syndrome which that cause the different complications. So we will learn all these things. So there are two types of Turner syndrome. In classical Turner syndrome, X chromosome completely missing. So in this way the X chromosome will completely missing and not occur. It means the X chromosome absence. While on the other hand, the second type of Turner syndrome is the Mosaic Turner syndrome, which that X chromosome partially abnormality will be occur. So the abnormal X chromosome partially, basically that is the defected gene containing X chromosome. So the sex chromosome. And in this way here you can see the autosomal dominant mosaic Turner syndrome. First of all we will discuss. So in this way here you can see this is the male and female married together to reproduce the children. So the affected father can be the affected alleles are present in the X chromosome while the Y chromosome is normal. So in this way the X chromosome affected which that will go into their offspring, and in this way the unaffected female contain normal X chromosome in the form of pair, that is sex chromosome, because female contain two X chromosome while the male contain X and Y chromosome. So in this way they can reproduce different childs on the basis of the chances will be affected and non-affected, unaffected. So in this way, here you can see this is the male, female, male and female. So the affected son can be reproduced. Why? Because the X chromosome will come from the father. So that is why the affected son. While on the other hand, the female which that will reproduce, and it can be unaffected. In this way the unaffected due to the recessive gene, affected recessive gene will be occur. In this way the affected unaffected daughter will produce, while on the other hand the chances is the carrier, it can be carrier. While on the other hand, the unaffected son can be produced. Unaffected means the X chromosome will be unaffected because the X chromosome will come from the father. Basically, it will be normal because the defected gene will be recessive. On the other hand, the affected daughter can be produced, which that is the X chromosome will come from the father. So the affected son and affected daughter can be reproduced, but the female will be more. The chances for the female will more. So the classical Turner syndrome is basically the different. In this way the meiosis will be occur in the reproductive system of the male. In this way the non-disjunction will be occur. Non-disjunction means the meiosis 1, which that will produce the 2n plus 1x, and it means the additional X chromosome will be added, while the non-disjunction means 1 will be empty for X chromosome. So in this way the meiosis 2 will produce the 1n plus additional X chromosome, while the 2 will be 1n negative 1 X chromosome. In this way the X chromosome will be missed. After this missing X chromosome containing sperm, which that will be spermatogenesis will be occur to produce sperms that will be fertilized with the egg. So egg contain normal X chromosome, but the sperm contain abnormal. It means X chromosome are not present, but it can be produced the female. But remember this, after the fertilization the XO female will produce. For example, the normally the XX, but the abnormal Turner syndrome will produce the XO. So in this way the loss of second sex chromosome will occur, and in this way the loss of second chromosome will lead to cause Turner syndrome after the fertilization. So I hope you make sense about these things. Let's begin to understand and go to the sign and symptom. So that's what can be a sign and symptom. So let's begin to understand basically. So here is the sign and symptom can be a sign and symptom can be different for different individual containing Turner syndrome, but the common is the low posterior hairline and the webbing of neck, the broad chest, widely spaced nipples. On the other hand, the streak ovaries, amenorrhea, infertility. But on the other hand, the cube cube two basically the so on the other hand, here is the coarctation of aorta, coarctation of aorta and heart shaped face and short stature. That is all is the basically is the type of the sign and symptom. So let's begin to understand the treatment, the treatable symptom. What is the treatable symptom? A symptom which that's contain Turner syndrome. So it can be health check and the basically the growth hormone therapy, which that is used for the growth and the estrogen and progesterone replacement therapy and psychological therapy. Learning difficulty can be correct and help and support which that will lead to a correct and treatment involving process. But in this case, what is the growth hormone? The growth hormone is basically used for the developing during the early age of the Turner syndrome containing patient, while the daily injection of the growth hormone is very important for normal growth. And in the on the other hand, the estrogen therapy, which that is used for the and on the other hand, the exercise and physiotherapy and the surgery for heart treatment if the heart will be damaged. So on the basis of requirement, any middle ear infection should be treated. Medication for blood pressure can be treated. Almost all women are infertile, but pregnancy with donor embryos may be possible. So can be possible, but sometimes not, but can be possible. So after this treatment of the growth hormone and the estrogen, progesterone, and there is several things because the female is involving for the Turner syndrome more. So what will be outcomes after the treatment? So after the treatment, there is a lot of the changes which that will treat it. So after this treatment, it can be a normal person, look like normal person, if early age of the Turner syndrome will be treated. So in this way, the liver will basically metabolism normalized, liver function and enzyme production. That will be all things will be okay, and the sexual function normalized, sexual desire basically on the basis of sexual desire. But on the other hand, the brain and central nervous system, if we will discuss also. But first of all, we will learn about on the other hand the things is the basically here is the brain. The brain and central nervous system will lead to treated improve learning, cognition, mood improve, memory improve, and there is a lot of things. On the other hand, we can learn more quickly and easily if the Turner syndrome will be possible and occur. So on the other hand, the cancer risk which that will be decreased and no increased cancer risk after that treatment, and the cardiovascular system and lower blood pressure, improved lipid profile, normalized coagulation system which that will be enhanced. On the other hand, the weight and metabolic changes which that is decrease the visceral adiposity. It means the decrease of the visceral adiposity because the Turner syndrome contain visceral adipose tissue which that will lead to cause the colorectal cancer the heart attack, and there is a lot of thing, arteriosclerosis, and increase muscle mass and improve physical fitness. But on the other hand, the musculoskeletal system, which that increase muscle mass and normal bone mineralization, the mineral density can be increased and improved. So that's all thing about the Turner syndrome, treatment, sign and symptom, and after treatment. And we had discussed about the autosomal dominant mosaic Turner syndrome and classical Turner syndrome, which that is the two type. So this here we can clear this tutorial. So thanks for watching. Please make sure to subscribe, like and share. Ask the question for answer in the comment below and give the suggestion. If you like this video, please make sure to subscribe. Bye.